Ever wonder if doctors could predict your health future? What if they could tell you if you're likely to get sick again before it even happens? Welcome back to Research Breakdown, where we take the world's coolest research and make it easy for everyone to understand. Today, we're diving into how machine learning is giving doctors the power to predict everything from hospital visits to treatment success before it even happens. This is the future of healthcare, and trust me, you'll want to stick around for this one. All right, picture this. Every time you visit the doctor, you're leaving behind a digital trail of data. Now imagine if we could use that data to predict your next visit, whether your condition will get worse or how well you'll respond to a treatment. Sounds like something out of a sci-fi movie, right? Well, welcome to the world of predictive analytics in healthcare. It's like having a crystal ball for your health, but instead of magic, it's powered by machine learning. And here's the kicker. This tech isn't just for the future. It's happening right now. Let's break it down. Imagine walking into your doctor's office and they already know what's going on before you even say a word. Sounds crazy? But this is what predictive analytics is making possible. What if your doctor could tell you that you're at risk of readmission before it happens, and they could help prevent it? That's what machine learning is doing. It's personalizing healthcare in ways we never thought possible. But how do they actually pull it off? Let's take a look at the tools making this healthcare revolution happen. Here's where it gets interesting. Machine learning uses data, tons of it, to find patterns that even doctors might miss. And here are the superstars of the show. 1. Regression analysis. Think of this as your health forecast. Just like predicting the weather, it looks at your past health and predicts your future. It can tell your doctor how fast your condition might get worse, so they can act sooner. 2. Decision trees. Imagine you're making a tough decision. You break it down into small choices, right? That's what decision trees do. They help doctors make better decisions by turning complex situations into simple yes or no paths. 3. Support vector machines, SVMs. This one's a bit more technical, but basically, it helps doctors figure out which patients are at high risk and who's in the clear. It's like triaging patients before they even need it. 4. Neural networks and deep learning. Picture this. A computer scans thousands of medical images, X-rays, MRIs, and spots diseases doctors might miss. That's what neural networks do. They learn from data and get smarter with each case they analyze. 5. Ensemble methods. Think of this as getting a second, third, and fourth opinion from the smartest doctors in the world. Ensemble methods combine different predictions to give the best possible answer. Let me tell you about a real-life example that shows how powerful this technology is. There's this guy, let's call him Jack, who recently had surgery. Normally, after you're discharged, you're on your own until the follow-up. But for Jack, the hospital's AI system predicted that he might have complications, so they scheduled extra appointments and adjusted his treatment. Guess what? Jack avoided a second hospital stay, thanks to machine learning predicting what could have gone wrong. That's predictive analytics in action, saving time, stress, and even lives. Stories like Jack's aren't one-offs. AI is already making huge impacts in healthcare, like predicting disease progression. Imagine having diabetes, and your doctor can tell you exactly how fast it will progress based on your data. They can adjust your treatment and help you manage it better. Preventing hospital readmissions. Just like with Jack, hospitals can predict which patients are likely to come back and offer extra care up front to prevent that. Personalized medicine. Forget generic treatments. Machine learning looks at your unique data, your genes, your lifestyle, and tailors treatments just for you. No more one-size-fits-all medicine. Okay, this sounds amazing, right? But there's always a catch. While machine learning is revolutionizing healthcare, there are some big challenges we need to talk about. First up, data privacy. With all this data flying around, keeping it secure is super important. No one wants their medical history in the wrong hands. Hospitals have to follow strict rules like HIPAA to make sure patient info stays private. Then there's the issue of system integration. Not all healthcare systems are built to handle this tech, and getting them to work together can be a huge challenge. And finally, trust. Some of these AI models are like black boxes. They give great predictions, but doctors can't always see how they got there. If we want AI to be fully trusted in hospitals, we need to make sure it's transparent and understandable. Now, here's a wild thought. What would healthcare look like if every decision a doctor made was backed by the power of AI? Imagine walking into a hospital where every test, every treatment, and every diagnosis is optimized for you. Do you think AI will be a game changer in healthcare? Drop your thoughts in the comments below, and while you're at it, hit that like button and subscribe for more breakdowns like this. So, to wrap things up, machine learning is already changing how doctors predict health outcomes, personalize treatment, and prevent hospital visits. From predicting disease progression to tailoring treatments, AI is making healthcare smarter, faster, and better. But we've still got some big hurdles to overcome, like keeping your data private and making sure doctors can trust these AI systems. Huge thanks to Neha NK from Jane University for her groundbreaking research on this topic. If you want to dive deeper, I've linked the full article in the description below. And if you enjoyed this breakdown, don't forget to like, subscribe, and comment. I'd love to hear your thoughts on how AI will change healthcare in the next 10 years. I can't wait to hear from you. Thanks for watching, and I'll see you in the next episode of Research Breakdown, where we make the world's most exciting research simple for everyone.